Is your goal to have an unmedicated hospital birth? Let me guess. Disempowering birth stories are having you question if this is even possible. Well, I'm here to tell you it is. As a doula, I see it all the time. Spoiler alert, it rarely happens by accident. So let's dive in. Hi, I'm Kelly, your online doula, educator, and #1 fangirl for all things birth. On this channel, I help you learn how to avoid unnecessary medical interventions and how to feel empowered and ready for your birth. Tip #1, hire the right provider. Who you hire as your provider is the #1 predictor of how your birth experience will go. You heard that right, the #1 predictor. So if you've hired an OBGYN or a midwife, this will determine in itself how your birth experience will go. This is the same for your birth setting. So which hospital, birth center, or if you've chosen to birth at home, where you birth also matters. So listen, if you have an OBGYN, you have to understand that OBGYNs are trained surgeons. Their primary training is not in hands-off, normal physiologic birth. And sometimes their training or traumas that they've seen in the hospital can play out in how they view birth. And listen, this is not the case 100%, of course not. But as a doula, I've really seen this play out quite a bit, and it's something to understand about your provider. And so what I want is your goal is to understand the philosophy of your birth provider. Are they somebody who at baseline believes that birth is low risk unless proven otherwise? Or are they somebody that believes birth is high risk unless proven otherwise? Here's some questions you could ask your doctor to get to the bottom of this. Now don't worry, I'm going to put these questions down in the description so you don't have to take any notes. So question #1, ask your doctor how often is it that their patients want to have an unmedicated birth? And if so, how often are they actually successful in getting this goal met? Question #2, how do you, and for that matter, the hospital, support birthing people whose goal is to have an unmedicated birth? What kinds of tools, support, items are available for you to help you in this goal? Question #3, you gotta find out your provider's induction policy. The rate of inductions have skyrocketed, and I really want you to understand how your provider views induction. So ask this question early and often. As a follow-up to this, the final question to ask your doctor is, do they believe that induction should be offered at 39 weeks pregnant? If any of their answers are not aligned with your birth wishes, I highly recommend you fire your provider and hire someone else. Red flags only get redder during birth. Does that even make sense? You know what I mean. Notice I'm using the words hire and fire. You don't have to use the same terminology, obviously. I'm saying it to make a point. I want you to understand that you are a consumer in this process, and your providers, the hospital, the medical person, the birth setting, they're businesses. You have the right to make a choice about who you want involved in your birth. An example, when I was pregnant with my first, I asked my doctor what his episiotomy rate was because I knew in my birth plan I really didn't want an episiotomy. So I needed to ask this question directly. And when I learned his episiotomy rate was over 70%, you better believe I never came back for another appointment and found myself a different provider whose birth philosophy was more in line with what I was looking for. Tip #2, avoid a labor induction. The rate of labor inductions have skyrocketed in the US. We're somewhere between the rate of 21 and 41% of births being induced. Now, this is a really big range because the studies are kind of all over the place, but just to put it into perspective, back in 1990, the labor induction rate was only 12%. And so this is something to watch out for from your doctor is what is their philosophy for labor induction? The reason why you want to avoid a labor induction is because inducing labor can often trigger the cascade of interventions. So what this means is essentially once you introduce one intervention, for example, induction, oftentimes multiple interventions are needed afterwards to keep labor going. And so if it's your goal to have an unmedicated birth, starting your birth with an induction can oftentimes set you on the path towards medication. Another factor is that labor contractions are far more intense and much stronger when they have come on because of being induced. This increases the likelihood that you will request an epidural or pain medications to get through it. I often tell my clients it's practically inhumane to not have an epidural when you are being pumped full of Pitocin, because those contractions, those Pitocin contractions, are 10, 20, 100 times more painful than contractions brought on by your body's natural hormone, oxytocin. I talk a lot more about this in my free download, How to Avoid an Unnecessary Medical Induction. I've linked it below. You can grab it there and get all kinds of information about how to avoid inductions. It's important that I also talk about the difference between medically necessary reasons for inductions and elective reasons for inductions, because sometimes inductions can prevent cesareans, which oftentimes people would prefer an induction over a C-section. Knowing which conditions are actually medically necessary versus elective is really, really key to understanding if you should consent or refuse a labor induction. I also go into that in my guide. Tip number 3, labor at home as long as possible before going to the hospital or birth center. The longer you stay at home, the less time there is for any kind of medical intervention. Plus, oftentimes when you change scenery, labor slows down. The body has to feel safe and comfortable in order to progress. And so it's really, really common to think that you're really far along at home and then to show up at the hospital and, first of all, not be as dilated as you thought. And then 2, for labor to just not come on as strong. And so staying at home until you're at the, quote, point of no return is a really effective strategy for avoiding any kind of unwanted interventions. If you have a doula or a support team, it could be great to invite that team over to your house with you to labor at home and support you during that time. Learn the comfort measures that can provide you a lot of support during early labor. Teach your partner or your birth team how to provide comfort to you during those contractions. I tell all my clients to follow the 4-1-1 rule. So what this means is the 4-1-1 rule is kind of like the key for when to go to the hospital or birthing center. This means that contractions are 4 minutes apart. Each contraction is lasting for 1 minute long, and that pattern has been going on for 1 hour. If you're at the 4-1-1 rule, you can make your way towards the hospital. Even then, it's usually not a huge rush. Of course, there's so many variables at play, like how far you live from your birth setting. But the most important thing is to trust that instinct. Your body has wisdom and knows if you feel it's time, trust that instinct, it's time. And if you like these tips and want to know more, again, I've linked my free download, The Essential Guide to Avoiding an Unnecessary Labor Induction, in the description below. You can also tap the link on your screen. Next week's video will be on the #1 way to avoid labor induction. Go ahead and subscribe now so you don't miss it.